So we're trying to develop deep learning algorithms, AI, that can detect cancer really. One thing we are doing with AI is deploying it on images that are collected routinely within the NHS. And we can imagine a future where AI is being used to look for all sorts of diseases automatically on routinely collected images. So here we're seeing a CT scan. It's taken perpendicular to their belly, and so what we're looking through is a cross section. Here we've got the spine, we've got the ribs, and we've got the back muscles. And here are the kidneys. The first stage of our cancer detection system is to first find the organ that we're interested in making sure it's healthy. And so here you'll see a red boundary right around the kidneys. We're just highlighting them. What this allows us to do is it allows us to throw out all information that isn't necessary for our task, which makes the AI as efficient as possible. This end-to-end system performs in seconds. In the next stage, here's the kind of kidneys with all the surrounding tissue, but everything else has been thrown out. And in the final stage, using this image, we seek to identify the cancer. And here is our AI's prediction. So right from the beginning, we have the abdominal CT scan, the cut through of the patient, and we can map that spatially to where we think the AI has spotted a cancer. I think where we'll see AI be used in the future, in the near-term future, so within the next 5 to 10 years, will be extending and deploying services that we actually can't currently do. So things like screening for certain types of cancers would be too expensive, and so we can't do, say, screening for kidney cancer right now, because it would require that a doctor reviews every image, and that costs £15 to £45 per image. We can't do that purely because of cost. We can do that with AI. And so what we're seeing there is not anyone being replaced. We're seeing the extension of our ability to review images to domains that we haven't previously been able to afford. That's where we'll see it's really hard to predict beyond that, that's where we're looking to deploy our AI to extend what we already do. So we are in quite an early space. It's not being deployed right now. We're at the stage of it, we're right at the edge of it being deployed. We're right at the edge of it being recommended by the NHS. It's not quite recommended yet. We're at a place where we've tested these models in clinical trials. We've shown that it's just as good as radiologists at evaluating CT scans, for example. But we're not quite at the point of it being involved in the NHS yet. We're right at the edge. I think there's a very real future where we use the centralised nature of hospitals to train these algorithms. So we have the best radiologists, the best oncologists, the best doctors to help train our models. But once we've trained them, they are infinitely replicatable. And so we can take these same, say, world-class level doctors represented in an AI, and we can distribute them into community centres, into primary care places, so they're not centralised within a hospital anymore. This really democratises expertise. We can replicate that level of performance everywhere. One thing that the government and NHS has been pushing for the last few years is community diagnostic centres. So taking the strain off hospitals by asking patients to go to these kind of closer, more convenient settings for scans and other diagnostic tests. If we could similarly move like the world-class expertise there, so the doctors represented by AI, these highly accurate models could be used in these centres. We make the whole process of diagnosing patients much more efficient, much closer to the patient, and we make sure everyone's getting the same standard of care as well. When we train this model, it requires an enormous computer. Like, it requires 16 GPUs, they're called, made by Intel or NVIDIA, these expensive chips. And our AI model requires 16 of these simultaneously to train for up to 10 days at a time. And so we need these supercomputer facilities to train and develop these models, and these enormous data sets as well. But once the models have been trained, then they can be run on a computer like this, like a much smaller computer. So it's the training that's expensive. Once we have the models, they're really actually extremely cheap to run. We're talking like pennies, whereas a doctor might cost £15 per scan. An AI scan will cost pennies, yeah. So they can be, at the point of training, supercomputer, at the point of using, any computer can run them.